COVID-19 hasn't gone away by any stretch of the imagination, and living with restrictions has actually become the norm. Many people are waiting for the moment when life can get back to some kind of normalcy, but the long wait is definitely showing signs of fatigue.
Hi, Dr. Ian. As a young married mom, I'm starting to feel pandemic fatigue. For example, I'm tired of wearing a mask, I get claustrophobic, and I just get anxiety. It's been hard not to be able to see my extended family. I have concerns of them getting sick, and my family worries about me, my husband, or my kids getting sick. We're all just burnt out. How do we cope with this?
And to help figure out how to cope is clinical and forensic neuropsychologist and author of Stop Self-Sabotage, our good friend, Dr. Judy Ho. Hey, Dr. Judy.
Hey, Dr. Ian, how are you today?
Good, good, good. So, pandemic fatigue, is it real? How common is it? What's the latest with it?
Oh, Dr. Ian, it is so real. And pandemic fatigue has been defined by scientists as the human response to this unrelenting stress that can cause a person to feel physically numb or tired or just plain exhausted. And our body is not meant to be in this chronic state of stress where we don't really have real and specific answers. Sometimes I think for people, it feels like they're not moving towards progress. The directives keep changing every few days or every couple weeks, and people are just so sick of it.
You say that the first thing is pay attention to burnout if you're feeling it?
Absolutely. So burnout is a term that we often use to talk about occupational stress. But right now, I think we can see burnout in all the areas of our life. And the three key signs of burnout is this overwhelming sense of exhaustion. Even if you're sleeping a lot, you're still tired when you wake up and you don't want to get out of bed. Sometimes people will feel like they're at a distance with their loved ones or just increasingly wanting to isolate themselves. And finally, they just feel ineffective, like I'm being a bad parent, I'm not good at my job, I just am losing confidence in all the different areas of my life. And those are the three most common signs that people should be watching for right now.
Dr. Judy, people are trying to move forward during the pandemic. So much is unknown, so much is uncertain. Let's give them some tips, some quick tips on what they can do to move forward. And part of it, I think, you start with accepting your feelings, right? Start with that and then kind of enact some things that will help you kind of keep going.
Absolutely, Dr. Ian. We have to give ourselves a little bit of grace and forgive ourselves for maybe not being at our best right now and not feeling our best. And so accept the feelings, because if you try to stuff them away or suppress them, that's when it leads to risky behaviors. We're hearing people are saying, I don't want to wear masks anymore. They're starting to do more risky things, going out, getting together with friends without taking the real precautions they need to. And also some people, because of the fact that they are not accepting their feelings, are running to what we call escapist mechanisms to cope. That's why we're seeing people oversleeping, ignoring responsibilities, even increasing their use of alcohol and maybe drugs. So we just need to start with accepting that this is something that we're all dealing with. So let's just band together and think about ways to problem solve this.
So, Dr. Judy, what are some of the healthy things that people can turn to enjoy, to somewhat, bring pleasure back into their life, maybe even a distraction? What are some of those things?
Well, the first thing is it's important that you can feel like you're in control with some part of your life. So every day, think about one thing that you can do that does bring you that feeling of control, because we all need that as human beings, because it's a matter of survival. But the second piece is to get you away from that systematic and chronic stress. Start doing things that bring you joy. Instead of thinking about your to-do list every day, which of course you have to do to some extent, I would also recommend that people make a joy list. Think of the little tiny things that happen every day that you really enjoy. For me, one of them is just having a cup of coffee. So it doesn't have to be something huge and gigantic, but these little moments of joy that you can create for yourself gives you a tiny bit of relief. It reminds you of what's important in life and also gives you confidence that, yes, I can achieve happiness, even if it's just for a few minutes. And over time, that really builds up and starts to help you feel better.
Thanks for joining us.
Thank you, Dr. Ian. Always great to be with you.
Okay. Of course, don't forget to check out Dr. Judy's Supercharged Life. It's our podcast. You can hear it anywhere podcasts can be found.